You've probably heard that old saying, the dose makes the poison. Well, let me tell you, there are few things on this planet that embody that idea as perfectly as atropine. This is a drug that is literally walking on a razor's edge between being a life-saving remedy and a deadly toxin.
It sounds like a riddle, right? What could possibly connect the two? Well, the answer lies in a single, pretty remarkable plant, and it connects the vanity of the distant past with the critical care of today. So let's jump right in and start at the source.
You see, our story doesn't begin in some sterile laboratory. Nope, it starts out in nature, with a plant known by two very, very different and very revealing names. So on one side, you have belladonna, which is Italian for beautiful lady, and women back in the Renaissance actually used extracts from this plant to dilate their pupils because they thought it made them look more alluring. But on the other side, you have its other name, deadly nightshade. Yeah, that one kind of leaves little to the imagination. And the wild part? Both of these identities come from the exact same plant, Atropa belladonna.
So what is this stuff we get from the plant? Well, it's called an alkaloid. That's just a type of naturally occurring chemical compound. But more importantly, it belongs to a class of drugs called anticholinergics. And trust me, that name, anticholinergic, is the absolute key to understanding everything this substance does in the human body.
So, how on earth can one substance be used for cosmetics and as a lifesaver? It all comes down to the way it messes with our body's master control systems. Okay, I want you to think of your body as being in a constant tug of war. On one side of the rope, you've got the parasympathetic system. This is your rest and digest mode. It keeps everything calm, slows the heart, helps you digest, and it uses a chemical messenger called acetylcholine. On the other side, you have the sympathetic system, your fight or flight response, getting you all revved up for action. Now, atropine doesn't just pick a side in this fight. Oh no, it cheats.
You see, atropine is what we call a competitive antagonist. So here's how that works. Imagine your body's rest signals, that acetylcholine, are like keys, and they're designed for very specific locks, or receptors. Atropine is basically like a counterfeit key. It slides into the lock just perfectly, but it doesn't turn. It just sits there, completely jamming the mechanism so the real key can't get in. So let's walk through it step by step. First, your normal rest signal, acetylcholine, is heading for its receptor. But if atropine is floating around, it swoops in and gets there first, blocking the spot. With that lock totally jammed, the rest signal has nowhere to go. It's blocked. And just like that, the entire rest and digest system is silenced, which means, by default, the fight or flight system gets to take complete control.
So what happens when you shut off the rest and digest system all over the body? Well, the effects are widespread, they're dramatic, and they are, believe it or not, surprisingly easy to remember. And this brings us to this classic medical mnemonic. It's a rhyme that doctors have used for generations to remember the signs of atropine poisoning. Blind as a bat, dry as a bone, red as a beet, hot as a hare, and mad as a hatter. I know, it's pretty strange, but it is incredibly effective. And there's some serious science behind every single part of that weird little rhyme. Blind as a bat, that's the pupil dilation we were talking about. Dry as a bone, your saliva and sweat glands just shut right off. Red as a beet, that's because the blood vessels in your skin widen. Hot as a hare, well, if you can't sweat, you can't cool down, right? And mad as a hatter, at really toxic doses, it can cross into the brain and cause some serious confusion, delirium, and even hallucinations.
Okay, so after hearing all of that, you'd be totally forgiven for thinking this stuff is nothing but a poison. But what if those exact same effects, when they're carefully controlled, could actually save someone's life? Its most heroic role is definitely in cardiology. If a person's heart rate drops to a dangerously slow level, bam! Atropine blocks that rest signal telling the heart to slow down, and that allows the fight signal to speed it right back up. Ophthalmologists use it all the time to intentionally cause that blind as a bat effect for eye exams. And, maybe most dramatically, it is a vital, life-saving antidote for poisoning by things like nerve agents or certain pesticides, things that cause a massive, deadly overload of that rest and digest system.
And this brings us right back to that crucial point, dosage. Just look at this number, 1 milligram. That tiny, precise amount is often all it takes to treat a dangerously slow heart in a full-blown emergency. Now, let's compare that. As we just saw, treating a slow heart, what doctors call bradycardia, takes about 1 milligram.
But to counteract a severe nerve agent poisoning, a patient might need 20 milligrams, or even more. It's the exact same substance. The only difference is the context and the dose. And that, right there, is the line that separates the medicine from the poison.
So because atropine is just so powerful, it's got to be used with extreme caution. What is a lifesaver for one person can be incredibly dangerous for another.
For example, if a patient has glaucoma, dilating their pupils can trigger a medical emergency. For someone with an enlarged prostate, it could make it painfully impossible to urinate. And in elderly patients, that risk of the mad-as-a-hatter delirium is much, much higher. It's a powerful tool for sure, but one that requires absolute precision.
And really, that's the core takeaway here. Atropine itself isn't inherently good or evil. Its identity as either a poison or a panacea, a cure-all, is defined entirely by how much is used and who it's used in. It's just the ultimate example of medical precision. The story of atropine, from a Renaissance beauty trend all the way to a modern cardiac lifesaver, is really a story about balance. It proves that the line between a poison and a cure can be incredibly fine. And that kind of leaves us with a question, doesn't it? What else in our world is separated from good or harm by just a matter of dose or of context?